about a particular project on which you're going to work for this particular fellowship. So if you remember, we had 3 sessions of on project discussions, and therein we started with discussing theory of change, wherein we discussed the rationale of the project. That's the most important thing, because that would tell you what is the problem you're trying to solve, or what is the need to do your project. And it also tells you the context or your local situation in which you're trying to make or bring about the change by doing your project. Then we discuss the outcomes. If you remember, there are short-term, intermediate, and long-term outcomes for your project. The short-term outcomes could be the reaction or the learning that takes place. Intermediate outcomes would be the transfer of knowledge, which would take a bit of a time as compared to short-term. And long-term outcomes are actually the result, and it actually coincides with the link to the health improvement or your ultimate goal of your project. So then we also saw outcomes chain, right, or concept map, which at one end you put your intervention or your project, and the other end you have your long-term outcome, and you have outcomes in the middle. So that will tell you how the outcomes are linked to each other and how your small intervention can result into the long-term outcome, which is nothing but benefit to the society. Uh, then we jumped to evaluation, or also called as indicator matrix. We said that it is better to think of the evaluation questions which any evaluator, any stakeholder in your project may ask. So each outcome you take one by one and then start thinking what evaluation question uh, your stakeholder can ask. Okay, so these could be of two types. First of all, did the outcome happen or occur? So did it happen? And if it did happen, then how or why did it happen? So try and find answers to these questions by gathering the data, right? So then we moved to the indicators. Those are the ones which are smart indicators, if you remember. So these are the ones which will tell you or indicate that your outcomes have been achieved or not. We also discussed the data collection method and data collection source. Source is from where you collect the data, and data collection method is the method by which you start collecting the data from your stakeholder or from your sources. Then after all this background, we then saw some part about methodology as to how you can incorporate all your outcomes, data source, data collection method in your methodology and strengthen your methodology. So methodology, we discussed the timeline, and the main important from your project is we discussed Gantt chart, where we have your methodology or activities spelled out at one side of the table, and then you have your timeline on the other side, and then you go on filling the gaps. When and how are you going to achieve, or rather, when are you going to achieve these milestones or these main activities in your project? Okay. And then we also did divided into two groups, and we had two broad projects to discuss. Those were just to give you hands-on experience so that the concepts are clear, right? So now this is the time where you will have to discuss with us your project. Why are you doing it? What are you trying to achieve? That is your outcomes. And I'm sure you have your, if you've prepared Gantt chart, or if prepared or given some thought to methodology, well and good, fine. So you have your PPTs ready with you, and then Gaurang, are we going to divide them into two groups and we're going to have it, or
No, ma'am,
just
we'll
the
take
one
them
group?
together only.
We'll take
It's
them
just the two
together.
of
No,
us.
no,
So we're
no issue.
single group
No.
and uh,
So
define
then
timeline for each of
let's
them to
give
present.
them 10 minutes per participant. There are 10 of them.
Yeah,
So
okay.
is that fine? Hello?
That sounds fine, ma'am.
That sounds fine. Okay, fine. So each one of you, please try and stick to the timeline. So each would get 10 minutes. So out of those 10 minutes, I would suggest have 5 to 6 minutes to present, or 6 to 7 minutes to present your PPT or your project. And then all of us would ask the presenter the clarifying questions, give him suggestions. Remember, this is also a meeting where you try and strengthen your project. You try and get clarifications. If you try and have certain things which you've not understood, get it clarified today so that your project is strengthened. So this is nowhere final project. So you don't have to get tension. इतना tension वाला काम नहीं है. So this is just that before you start your project, you are well versed with your project and there are no obvious lacunae in your project. That's the whole purpose of, and when you listen to the others' project, you also learn a bit from, you also get ideas from the others' project. Okay. That's the reason we are having it together in one group. Fine. So then, should we start now? I want someone, so let's do one thing. You are 10 of us divided by your roll numbers. So we would start with roll number 1. And what I suggest is the next roll number, that is roll number 2, would keep the time. So that there is somebody who would keep the time. So when 2 presents, 3 would keep the time. Is that all right? Okay. So
Yes,
6
ma'am.
minutes is for presentation. So when the 6 minutes are up, please give some indication to the presenter that the 6 minutes are up so that he can wrap up. And then the total presentation time, including the question answer, is 10 minutes. So at the end, so that we finish on time. Otherwise, the last few, we may have to rush, and that's not fair to them. Okay. So, okay. So let's start. Rule number 1. Can't see your roll numbers. Yeah, yes. Go ahead. And who's roll number 2?
It's Arun, ma'am.
Arun. So Arun, you keep time
All right.
when the other person presents. You can start sharing the screen. Gaurang, you want to add anything?
No, I think, yeah, so maybe the timekeeper can just inform after 5 minutes so that 1 minute is remaining to wrap up.
Okay. So
And feel
inform
free and
after
comfortable. As ma'am said, this is not the final presentation, and feel free to ask your specific feedback if any.
Okay. Fine. Let's start.
Mike.
Dr. Anand has to present his screen, I suppose. You are not audible. Unmute.
Sir, how to share my screen, sir? In the
So
settings?
just option them.
Are you on the mobile?
Yes, sir.
I think in between in the lower half of the screen, bottom in between there is a share icon. Keep your PPT, open your PPT first.
Yes, sir. Yes, sir.
And then go to share.
Share content.
Yeah.
Okay. Actually, I shared with Nagda madam. Share and export. Just a minute, madam. Give me some time.
Can I suggest one thing? So, what you can do, Dr. Anand, is let the roll number 2, Dr. Arun, start his presentation.
Yes.
And you can email your PPT to Dr. Arun.
Yes.
And then after he finishes, then he would share the screen
Yes.
for you, and then
Yes.
you can talk. Is
Yes,
that okay, Dr. Arun?
Yes, ma'am.
Yeah, okay, fine. So, who's roll number 3? Unfortunately, I can't see the roll numbers. Yeah. So then will you keep the time when Dr. Arun is presenting? Yeah.
Ma'am, could you able to see my screen?
Yes,
Yes,
it's
yes.
visible. Please make it full screen. Go ahead.
Ma'am, the rationale of my project is the need analysis to shorten preclinical exercise duration in the first year MDS.
Can you talk a bit louder so that it's audible?
All right, ma'am. Ma'am, before getting into the context of the need of this project, ma'am, I just want to get into some background why I want to do this, ma'am. Ma'am, can you hear me? Hello?
Yes, yes.
Yeah, go ahead. Go ahead.
Ma'am, as Benjamin Franklin has said, tell me and I forget, teach me and I may remember, involve me and I learn. PG degree provides advanced training in various dental procedures and techniques, which can enhance the skills and knowledge of a dentist. Specialized knowledge can be advantageous in improving patients' care, expanding the scope of dental practice, and increasing the job opportunities. In UG dental education, the education is brief, whereas PG program offers more detailed curriculum in one particular niche subject. A graduate in dentistry is already a clinician with sound clinical exposure. So specialization in dentistry, like any other medical subject, requires intense understanding of the subject and requires to handle the challenging clinical scenario post MDS. At present, many dental institutions in India follows a curriculum wherein 6 to 12 months of PG program is spent on preclinical exercises. This reduces the optimum clinical exposure to the PG students in managing variety of clinical cases pertaining to the specialty, reducing anxiety. So it is therefore recommended that students should be introduced to clinical environment in the early years of their course so that they understand the importance of preclinical techniques. The problem or need of my study is due to prolonged involvement of first year MDS in preclinical exercises reduces the available clinical time during MDS curriculum. The context is MDS students have basic clinical and preclinical and clinical exposure during graduation. Therefore, providing a refresher exposure of preclinical exercises for limited time provide early clinical entry of first MDS students. So the aim is to assess the need to reduce the preclinical duration in the first year MDS students. Certain studies which have been done, it is almost similar to the early clinical exposure. There are few studies which quotes the importance of having a early clinical exposure and reducing the preclinical time in the undergraduate as well as postgraduate curriculum. The one such study closer to my study was a study done for first year MDS periodontology to expose them early to the clinic so that their clinical skills are improved in the end of the first year MDS. So I'm looking at three outcomes. The short-term outcome is to improve the early learning of the student regarding clinical procedure and to improve the psychomotor skills of the students on the models. And intermediate is to improve the learning and provides additional time to students in acquiring clinical skills. And the long term is to help in better treatment implied to the patients. These are my references, ma'am.
So, any questions for Dr. Arun? So, what I understand, yeah, go ahead, go
Madam,
ahead,
if I
go
may,
ahead.
uh, During this project for this fellowship, do we really need to include long-term outcomes?
This is for everybody, I believe.
Yeah.
Yeah, so when you're thinking of the project, it is better to think of long-term outcomes because then it becomes easy to convince your stakeholders that my project has some improvement in the health of the society. But when your project scope, I know it's not uh, possible to actually capture the data for long term. That is only if you continue the project for a longer period, then you would able to capture the data. You got it? Yeah, but in
Yes.
the methodology, that part you cannot include at this stage
Okay.
because time-wise, it's not possible.
So when we apply for the ethical IEC, in the protocol, should we include the long term now itself, or we can?
You can include the long-term outcomes, but you can say that this would be possible to capture the data only when it is only if I continue the project. So depends how in detail your EC goes through your project. Is there in a particular format in which EC asks a submission, then you'll have to follow that format. That may
Yes.
not have outcomes in the may not, I'm saying. Yeah. So any particular questions for Dr. Arun regarding his project?
Right.
So what I understand is in your postgraduate yes, go ahead.
Wanted to know the method of assessing the students and
Ma'am, is this course is only for the institution purpose or it is like university it has to be submitted?
You are asking me or asking Dr. Arun?
Yes, ma'am. Yes,
Dr. Arun. Yeah.
The study will be done in an institute, but the implication is recommended to the Indian scenario.
You mean, Dr. Anand, that this is something related to improvement in curriculum design for MDS students?
Sir, there is no mention of this in the curriculum stating that 6 months to 1 year, but it's a followed methodology in most of the colleges. The curriculum of various university doesn't mean that 6 months to 1 year, but the present practice by all of us in our institutions are being 6 months to 1 year. And same thing is being done in our institute too. So it is a recommendation, any of the institution following this methodology can adopt a methodology which can improve clinical exposure in early time.
Yes.
So it will help in improving the guidelines.
And sir, how to assess the throughout the procedure, how to assess whether this is a better version by improving the clinical exposure?
Ma'am,
Any assessment methods?
in my outcome, I have mentioned that while there are two ways. The first way is to, in the short term, that we are going to assess how their improvement in their preclinical exercise itself, since we are exposing them early into the clinical exposure, how their the psychomotor skills are improved. That is my short-term assessment, and that is on a measurable scale by the clinicians who are observing, the teachers who are involved in observing. And in the intermediate term, their clinical exposure or clinical time, they could do many number of cases. Patients are increased in handling, in comparison to the regular curriculum, wherein after 6 months a student goes and touches a patient, or before 6 months, or reducing it to 3 months, he touches a patient. So number of cases he handles before this time could be monitored in the middle, in the intermediate, and in the long term we could able to uh, understand, if we continue the process till end of the third year, the amount of clinical benefit, or the patient treatment benefit, or its improvement in the clinical skill of the student at the end of the third year.
No, so Dr. Arun, you are trying to find out, it's a needs assessment project where you are trying to find out at present the preclinical exposure in MDS is almost for a year. So
Yes.
you feel that it's a waste of time for their MDS period. So you can, whether it can be shortened to whatever, 3 months, 4 months, or whatever it is, right?
Yes, ma'am.
Am I correct?
Exactly, ma'am.
So how are you going to find out whether what you have thought is thought by everybody else? What are you going to actually do in your project?
Ma'am, what I'm thinking of doing is one is an assessment by the students, the students who are in the second year presently. Their what is their they be taken as a reference, and that the present first year will be allowed to. There will be a comparison between the first year students and the
No,
second
but
year students.
the first year students are going to undergo this preclinical only for a 3 months period or 6 months period, something like that. What are
Yes,
you
ma'am.
comparing? But is that allowed just because it's your project?
Ma'am, basically the allow is there is they if they able to complete it, or if we can take them into the early exposure by completing their preclinical exercises, the recommended preclinical exercises, then what is required to be achieved by the institute or by the college is being achieved. The only thing is what they are doing is by going into the clinics and doing the preclinical side by side, not stopping them going to the preclinical to the clinical is what is hindering their progress.
Okay.
So it is nothing disturbs the institutional requirement or the university requirement.
So you're going to give them the preclinical exposure side by side to their clinical posting instead of totally putting them into preclinical and not giving them any clinical exposure. Am I correct?
Yes, ma'am. The present scenario is that students are not allowed to enter the clinic till such time their preclinicals is completed. So that would, as we see in the EC in the early clinical
I
exposure
agree,
also.
but are you in a position to change what is happening in your institute? You said they are not allowed to enter the clinical. So now you're saying that I will give them preclinical and side by side they would do their clinical. So will they be allowed to enter the clinical scenario?
Ma'am, it is basically the students who are able to cope up with this scenario of doing their preclinicals. So that would be
No,
motivated
I'm
and
only asking from the feasibility point of view. Will it be feasible for your students to allow or enter the clinical side before they finish the preclinical, which is the prerequisite at present in your institute?
ma'am, it is feasible. It is sometimes it's also been done during the COVID period when they do not have
That's
the
okay. That is
clinic.
exceptional. COVID was exceptional, correct?
So this could be done in an interest so that it can be explained to the fellow colleagues and to the head of the institution that this may be checked so that if it works out can be implemented subsequently. So that is
Okay.
allowed.
What I just think about it, what I was thinking, it's a needs assessment to
Yes, ma'am.
try and find out what is the need to reduce the duration of preclinical exposure from 12 months to whatever shorter period. So, how would you assess that need by taking perceptions of the stakeholders involved? So, why don't you do that? Why
So
don't you go ahead and take perceptions of your stakeholders? The stakeholders would be your second year students, your third year PG students, faculty in your department, and maybe faculty and students of the other subjects. There also the same system must be followed, right?
yes, ma'am. That
So
is an
then, but
easy
the important part here is you will have to draft a nice questionnaire and get it validated.
yes, ma'am. That is an easy
It's
and a
not
proceedable.
easy. It's not easy to develop a questionnaire. I am
All right,
sure
ma'am.
when Dr. Amol Dongre takes a session of qualitative studies with you and developing a questionnaire, it would be, or it would be clearer, or if it's already happened, then you may know that a lot of efforts go behind the call. So at least by your project, this short project, you would gather the evidence to show that yes, it is everybody feels that instead of 12 months, you shorten them to 3 months or 6 months. But that questionnaire is going to be very, very important. Fortunately, all the other 9 fellows are from the same faculty as you in this course. So what you can do is you prepare a questionnaire and give it to them for validation.
All right, ma'am.
Correct?
Yes,
So
ma'am.
just think about it is what I feel. So that would tell you the need that, okay, everybody is in one page. And then you can go ahead to your admin and say that, boss, look, everybody is saying that it should be reduced to whatever. And because of so many reasons, your questionnaire will not be only should it be reduced from 12 months to 6 months? Yes, no, aisa nahi. You'll have to you have to think about what all questions you want to ask and why it is necessary to reduce from what would be the advantages. So have a combination of open and close-ended question in your questionnaire.
Understood, ma'am.
You got it? What I'm trying to tell you?
Yes, ma'am. And this sounds also, what I mean to say, an easy one is it is a clearer picture rather
Correct.
than trying to ask the first year student and experimenting. This is a clearer picture.
Correct. 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 Somebody started sharing the screen by mistake, I believe.
Yeah, I think I did by mistake.
I wanted to come in here.
Madam, go ahead.
Yes.
Arun.
Yes, ma'am.
I think somebody asked a question, Jyoti, I don't remember, that will this have an impact on university? First and foremost, Shilpa asked. So first and foremost, this 6 months, 1 year was started because MDS became 3 years, and many colleges wanted that to be structured so that the students are busy with that. That many patients for the postgraduate may not be there. So now you need to not only ask your 10 colleagues, but your college people, you should have a focus group discussion. Next Tuesday, we will have how to prepare a questionnaire. I think Chinmay will do that with you. And validation, Dr. Gaurang will also join. All the Cron's index and other things and all we will do, so that you preparing the questionnaire is the most difficult part, one. Secondly, you just go and apply it. You're comparing it against what? And with whose stakeholders involvement have you taken it? People won't cooperate. People will say, "Ek aisa hi isne karke dekha," lekin we don't think so. It is now possible. Now answering Shilpa and other people who asked regarding long term, yes, this has to have a long term effect of intermediate 4 to 5 years, but long term, if you want to study, we have to be patient for 8 to 10 years. So immediately, the students also don't like. You can take, there are multiple need assessment studies you put. Past students who have passed for the last 3 to 5 years, if they can answer what is the value addition for their preclinical work that they did. Was it pulled? One student told me, they pulled it so much, madam. Even the for final year students are respected more as far as the arrangement is concerned. And we are asked to do this and do that, and not necessary. Not necessary. You're absolutely right. This will give a scientific background to what we all think the same thing. But need assessment of 3 past students, what was their perception on the preclinical work, about your teachers in the college. You can even include teachers around AFMC, if it is Pune, Delhi, or wherever it is, they can also answer. You can also take help of the nearby colleges if at all you want to increase the population to ask.
Okay.
But it is very important you have a focus group, or are the other people with you on the same page? They also feel like that. Did the past students also felt that it was too much pulling and scratching on the same thing of arrangement and tooth preparation and all those things? Instead, why not we go more modern? The students are contemporarily wanting to do the aesthetic materials, the newer composites, the newer these things. We can do it locally. Nobody is going to question you. University is not going to question you. We don't want to come out of the comfort zone. That is the main thing. So as Ashwini said, I was going to say the same thing. Have you done the need assessment? Do you have the questions? Are there questionnaire available already? Then can you take the permission of the author and modify it? If questionnaire is available, we can use it. But the questionnaire, you should write an email to the author that I want to use this. They generally never say no. See, there is a question of copyright here. You cannot pick up something from the literature and say that I'm using this and I modified 1 or 2 things and it's mine now. No. You're coming on the intellectual property of other people. So let's give the due. I think it's a good study provided you are thinking on the right steps of the past students, the other students, the faculty, what they think, focus group, and all these things. And then literally you come out with a plan of completing it in 6 weeks. Students should not be in the preclinical work more than 6 weeks. I have never seen any college abroad having more than 2 weeks. In fact, they send them to the restorative department where they do the root canal, etc. They send them to the perio department 1 week this department, 1 week radiology department, 3 weeks to wahi ho gaya. Then they send to the medical side for maxillofacial. They send them for suturing. So ये सब करके तुम्हारा preclinical work जो है, because you are not developing them as a technician. What we are doing is laboratory technician course for them, plus MDS. So please think it over, develop it more, come and present again. And next time when we have questionnaire session, we'll see it again. Thank you.
Thank you, ma'am.
Can we move to the next person? Dr. Anand, have you solved the problem of how to share your screen? Are you able to do it? You're not audible. Dr. Anand, are you able to do it now?
He is muted.
Actually, I send it to Arun Kumar sir.
Okay,
Ma'am,
okay.
ma'am, I just projected, ma'am.
I send him
Sorry?
by WhatsApp. I did not have his mail ID, so I send him to WhatsApp.
Okay, fine. Let's move to roll number 3. And Dr. Arun, you can download it and send it to your email and whichever way. Yeah. Okay. And roll number 4, please keep the time. Yeah. Make it full screen, please. Kindly start presenting, make it full screen and start presenting. There's this hourglass arrow symbol at the down here.
Full screen PPT karo.
Yeah. Click.
Where you increase the volume now, left of that, there is a hourglass. There is a small cup as a present to you. Make it full screen.
Ma'am, I'm having trouble. Let me do it, ma'am, one more time.
No, it's prop. Acha.
ये शेयर हो रहा है मैम?
क्या हो रहा है?
स्क्रीन शेयर हो रहा है?
It is
Screen
here.
share हो रहा है.
Now you just open your PPT.
Okay. Is it visible?
Yeah, but open it, na? Yeah.
Yeah. Now maximize it. Slideshow.
Okay.
Correct. Click. Yeah.
Yeah.
Done. Chalo, start.
So I have tentatively prepared 2 titles. I'm discussing with Nagda ma'am in the morning. So let you people help me which one to choose. The first one is mini sets or direct observational procedure skill, that is DOPS assessment in the post preclinical exercise period, a valuable tool in the postgraduate dental education. I just want to assess the first year postgraduate students after they have completed their preclinical exercise for a period of 6 months. Either I am planning to do this one, or I want to assess the postgraduate students in prosthodontics after first year session is over, second year session is over, and third year session is over. Why I am getting confused is that I will get only 3 students per session if I am going for the first one. And if I am opting for the second topic, then I will be getting total of 9 students per week. That's why I'm confusion which topic to choose. Okay. Coming to the introduction, in the global scenario, dental postgraduate students should be prepared with the abilities of critical thinking, professionalism, communication, interpersonal skills, health promotion, practice management, and informatics, patient care involving assessment, diagnosis, treatment planning, and establishment and maintenance of the oral health. Work-based assessment or WBA helps in assessing the progress of the postgraduate trainee in acquiring the skill set to work independently in an actual clinical scenario with the added advantage of feedback that is given to the performance for the further improvement. Now, why I choose this study? What is the background? Currently in India, the dental education system is driven by the examination, including the content only. Okay, the students prepare in the exam according to what syllabus has been given. The approach to the patient management is specialty wise. The student may perform exceedingly well in the academics, but they may not be ready fully for the clinical practice as there is an inability to apply the theory in the practice. Hence, it will be appropriate to move towards what learner is expected to do rather than what the learner is expected to know alone. So the need of the study, why I chose this study is assessment of the first year PG postgraduate student before entering into the clinical work area. Because what they do is after simply finishing the preclinical exercise, we put a signature that they have done the exercise properly, and we directly allow them to the clinic directly to allow them to touch the patient, which is a lively structure. Okay, so we need further assessment whether they are competent enough to touch the patient. Because we do it in a random manner, there is no such proper assessment method till now. So I think if we'll do this one, it will be a proper method. The context is same. In our college, in most of the colleges, once the preclinical exercise is over, we simply put the signature in the preclinical record book and allow them directly to enter into the clinic. So they do variety of the clinical work in the removable processes, fixed processes, or in the implant section. So if we'll do a proper assessment, it will validate their entry into the clinic. That I think. For the study design, whatever I have found from the review of literature of other studies which have been done, I am planning it to do a multicentric study in the manner that since 7 or 8 of the prosthodontics colleagues of mine are here in this group, so I am planning to do a multicentric study because in my college only I will be having only 3 postgraduate students per session. So that won't suffice the sample size. So I am planning it for a multicentric study. All the PG students who have to undergo the preclinical exercise training for a period of 6 months as it has been prescribed by the DCI. So I'm not overruling anything new. It has been prescribed by DCI. So they are as such doing the preclinical exercise for a period of 6 months. I just want to assess them before they enter into the clinic. And for the ethical clearance, okay, for the ethical clearance, ethical approval of this study will be obtained from the ethical committee of the SWA university in which I am working. And if I'll be taking the help of my colleague, they have to take the ethical clearance from their respective university. Okay. Now, this is not my idea actually. I have referred this thing from the literature, which I'll be showing you right now. So the assessing method is that mini-6, that is a mini clinical examination or direct observation of this assessment scale will be used. It will evaluate the core competency of the postgraduate student with a real patient during the training in the Department of Orthodontics from various aspects. Now, what are my doubts are that if I have to, in the preclinical exercise, we are taking so many topics, that is removable prosthesis, fixed dental prosthesis or dental implant. I just want to take help of Nagda ma'am that whether I should stick to one particular topic, that is a removable one, or whether I should involve all the preclinical exercises topic. Okay, and the time of the assessment will be a beginning and end of the preclinical exercise training. There will be 3 different assessors in each institute, which will report to the principal investigator to avoid any bias. Okay. Now coming to the reference, this is one article that is BNC Medical Education 2022, which is very similar to mine one. A novel strategy combining the mini-6 and OSCE to assess the standardized training professional postgraduate in the Department of Prosthodontics. Now, how my study differs from this one is they have simply recorded the clinical history, clinical case history, generalized examination of the patient, in this 2022 article. What I want to do is that I want to involve some clinical procedures which will make my study different from this one. Now, other articles involving the same one was from the Journal of Family Medicine Prime Care 2020. Similarly, involving this mini 6 portion. Another one is the Introduction to Mini Clinical Evaluation Exercise in the Teaching of the Radiology Department, in the Radiology, a pilot study. This article is also been published in 2020. Thank you.
Stop sharing.
Yes, ma'am. I'm just waiting.
Hello. Hi, Narendra. Good. No problem. No speaking. No.
Any questions for Minna? Minna, I have a question.
Yes, ma'am.
You're planning to impart mini CX and DOP to assess the preclinical knowledge or the skills of your students.
Yes, ma'am.
But correct me if I'm wrong. Preclinical में students are working on the models, right?
Yes, ma'am. Yes,
They
ma'am.
are not exposed to the patients.
No.
So how would you assess their knowledge and skills and attitude, what they learned in preclinical period by doing mini CX or DOPS?
Okay.
Because mini CX would have to have a patient in front of the student.
So what I'm planning to do is that if I'll involve something which is non-harmful to the patient, that I can give a demo before they touch the patient, and then only they can proceed further.
No. It now boils down to what your objective of the study. What do you want to teach, or what do you want to gain out of your study?
Ma'am, actually, I want that after doing the preclinical exercise, they directly touch the patient in the clinic for the first time.
Okay.
Prosthodontic cases.
Okay.
So instead of directly touching the patient, I just want to see the competency level before actually they touch the patient.
Okay. So you want to assess whatever is been whatever skills they have learned in that preclinical period, whether they have learned it correctly and they're doing it with precision or not.
Yeah. So that
Right?
patient care won't be affected. Patient's clinical procedure won't be
Fine. So that's your objective to begin with, right?
Yes, ma'am.
So
Yes.
then after they finish their preclinical period, why don't you have a DOPS wherein they do it in the model itself?
Ma'am, they are already doing it in the model.
Yeah, but you are not assessing.
Yeah.
Are you assessing that?
No. We are not assessing, ma'am.
You are not assessing.
We are assessing in the model whether they have done it properly or not.
Are you assessing at present?
Assessing means, ma'am, there is no such format is there. We are simply, it's a subjective one, you can say.
So it's not documented, it's not done.
It's not documented whether you have touched this aspect correct. I will give 1 mark. You have touched the second point. I will give another mark.
And is there a feedback after you of whatever you are doing at present? Do you give feedback, formal feedback to the student?
No, ma'am, no.
So then that you can think. You can think of implementing
because
DOPS.
after they have finished the exercise, suppose I am the in charge and I see that they have nearly achieved the goal up to 80 to 90%, I just sign that assignment that you have completed.
I understand, but see, at present, what you have put forward as your study is the students have preclinical where they're not exposed to any of the patients, and then when they finish their preclinical, when they come to the clinical side, you're going to assess them with mini CX and DOPS.
Ma'am, that's why that is one of my proposal, and the second proposal I have, that's why that confused me little bit. So I have put another one, like the students of the prosthodontics, they complete the clinical procedure after first year, second year, and third year. They are subjected to variety of the patient with difficulty level. In the third year, we give them a tough level of patient.
Okay, so I understand. So why don't you restrict yourself to, first of all, either DOPS or mini CX for this particular project?
Ma'am, that help I want to take from Nagda.
So
which will be better.
You can restrict yourself what you want to in your subject. Is the procedure this is a skill based subject, right? Dentistry is mainly skill, a lot of skill is involved. So if there are different procedures which your first year, second year, and third year is supposed to learn and do, then you can choose from first year one procedure, from second year one procedure, and from third year one procedure. And then they so you can say something like DOPS, use of DOPS as an assessment method for learning in prosthodontic PG curriculum.
Okay, ma'am. Just ma'am, one question. Suppose the thing I am assessing in the first year, can I change the topic of my assessment for the second year? Suppose I am
You will have
assessing.
to. You will have to. Because the skills required to be attained by the first year would be different from that of second year and would be different from that of third year. Some higher procedures would be done by third year, right? What I
Yeah.
understand. Correct.
Yeah.
So then that's why I'm saying the procedures which you want to assess using DOPS would be different for first year, second year, and third year.
But then again, ma'am, how I have to standardize the thing? Suppose in my institute, I am giving a demo for a clinical procedures, then the students are doing. By the end of 1 year, I can assess them. But if I am going to take the help of my colleague,
No. That's another thing I wanted to ask you. Doing multi-centric study with such a kind of a thing is it's a big effort, because then you don't know how standardized it would be in the other colleges. But why do you want to jump for multi-centric? You have three
Can I come in?
postgraduates
Can I
per
just-
year.
3 postgraduate means, ma'am, I will have only nine
9 postgraduates.
participants.
That's okay. That's convenient sampling.
Okay. And ma'am,
That's
how to
convenient
standardize
sampling.
this one? Suppose for the first year, all the 9 students are not under me.
First year, you'll have only
That
3
doesn't
students, right?
matter.
Yes.
That doesn't matter.
So you'll have to train your faculty.
Yeah, that's what I was coming to. The faculty doesn't know what is mini CX. So you have to train them in that. And 3 students and 3 more faculty assessing, and one procedure like tooth preparation or whatever, you have to see. Research is something where you have to funnel down. We talked about it last time. At least,
But ma'am, suppose for tooth preparation, I am giving the let me take an example of clinical complete denture. Suppose I am giving the demo to all the 3 students for the complete denture, then the assessment only I have to do or somebody else has to do?
somebody else also has to do, because then only you will get. See, first of all, you need to read their workplace based assessment, it's called. Workplace based assessment, when the student or the learner is working, that time you are skill assessment it is. So whether it is DOPS, just observing, not saying anything, then giving feedback, that is one. And mini CX has a multiple amount of checklist wherein the instrumentation has 5 marks, instrumentation tooth preparation, how the history was taken 10 marks, like that you have to give and do it. I think it's a big thing. First and foremost, last year, if you remember, Ashwini Medha had done that.
Yeah.
Medha. And she
Correct.
had 6 assessors.
Buskute. Metha Buskute, correct.
And don't confuse between mini CX and DOS. Both are skill-based procedures, and both are, there are difference in that. And it's called workplace-based assessment. You have to read. You have to read 4 or 5 articles. Read the book in education. What we had initially recommended. I'll send that book soft copy to you. But that may contain only little, but cross references will be there. Read it and then
Ma'am, I have one more doubt. Like for the first year postgraduate students, can I take the complete denture preparation in the second year? I can take the fixed prosthesis, and in the third year implant one, or
no,
I have to include more and more topic per session.
No, I think the same thing should be done. If you're taking the removable prosthesis, it should be for all the 3 years removable prosthesis. And what part are you taking? Impression making, you're taking. See, you cannot, statistical evaluation cannot be generalized. It has to be done for a specific thing. Isn't it?
No, but if that skill is not being taught for first year, then she cannot assess it for the first year. I mean, I don't know, so I'm asking. Some procedure which is not expected out of first year resident, how can you evaluate or assess using DOPS?
Yeah, so she has to take a topic which is throughout similar.
Maybe either you go for a topic which is common to all, or you go for different topic per different year, and then you can analyze of do statistics all 9 students together, because what you're assessing is the use of DOPS, and you are not assessing that particular skill. You are not assessing tooth removal karna hai ki kya karna hai. You are assessing the usefulness of DOPS as a learning tool in your postgraduates. Are you getting it? And this is for everybody. Whenever you do a particular study in any of your topic, whatever is the broad area of the topic, you have to read that from a particular standard textbook. It need not be a reference or a same study already reported in the literature. If her topics involve DOPS, then she has to know A to Z about what is DOPS. And that may not be given in detail in any of the references or in the literature studies. That you'll have to resort or read a textbook in medical education or in dental education, which talks about DOPS. Similarly, earlier, Dr. Arun's project, it was questionnaire. So he has to know in and out about questionnaire.
Ma'am, on the if I reverse this thing, like the preclinical exercise I have taken, instead of mini clinical examination, is there some other method?
No, but
Questionnaire
I'm telling
method
you, don't go for everything, no, at one go. Restrict yourself only to DOPS.
When you are using the word mini clinical examination, I don't think we should apply it for the preclinical work. It's a workplace based assessment. And Mirna, your thought process has started. I'm very happy. But now you read about mini CX and also read about DOPS. See, these are examination methods which are very good. Now the students feel that the examiners are just assessing the overall and giving us the mark. They are not assessing the border molding in particular, or they are not having checklist. So the random marking what is giving is creating a lot of dissatisfaction among the students. In the formative exam, this direct observation mini clinical gives you a chance for feedback. Timely feedback makes the students learn. So instead of just 9 students you have, and the skill they have for either fixed or removable is already obtained in the final year. They know how to make an impression, or if you are taking student instruction or whatever, and the patient instruction. So still you are requested that you read this, think about it deeply, and then come back. There will be some. Now in this one session we cannot finalize yours or Arun's or anybody's.
Okay, ma'am. Ma'am, just one
Ma'am,
more.
can I just add one more point?
Should I stick to one topic throughout the first year, second year, third year, or should I change the?
No, you cannot change the topic. You are again confused.
No. I mean the clinical assessment I am doing. First year postgraduate student will be different from the second year or and third year, or it will be the same removable processes for all the third year.
It will be same, but the level of the student understanding and performing will be slightly different. That is, you will have to check that.
Okay, ma'am. Okay,
Ma'am, can I just add to one point?
Yes.
That the purpose of this project is to introduce mini CX or DOPS into your system, which is currently not existing.
Yes.
So it's simple in the title that way. Title can just be introduction of mini CX in postgraduate dental assessment. And that's it.
And what assessment I have to specify? Na?
That is up to you to decide, ma'am. You can decide. The idea, the focus or emphasis is on the process rather than getting too much stuck about ki kaun sa technique kya procedure le rahe ho.
Okay, ma'am. Okay, ma'am.
The checklists are quite universal. They can be generalized to any kind of interaction or scenario. So go through the checklist for DOPS and mini CX also. That will help you to decide कि आपको क्या लेना है, what would be relevant in your case.
Okay. Thank you, sir. Thank you so much. Thank you all for your feedback.
Can we move to the next? Who's presenting?
I'm presenting
Yeah.
Can I share my screen?
The discussions are going a little bit beyond time. So let's be more crisp and precise while giving our feedback.
Shall I start, madam?
Start.
Yes. My topic is broadening horizons, proposal for elective courses in BDS curriculum. So the background for taking up the study is the current BDS curriculum lacks diversity and limits the students' exposure to the multidisciplinary learning. The need for dental education. So BDS curriculum has to change and has to adapt to the needs of stakeholders. For example, students, teachers, industrial partners, society, and patient care improvement. The elective courses in the BDS curriculum is to provide the students with the opportunity to explore the specific areas of beyond the core curriculum. So what is the need for these elective courses? So as I mentioned, the elective courses in the BDS curriculum, they serve several important purposes. Firstly, they allow the dental students to explore the specialized areas of interest within the dentistry. So by selecting elective courses, the students can delve deeper into specific subjects that align with their career goals or the personal interest. Secondly, the elective courses provide broader and more well-rounded education. The dentistry encompasses various disciplines such as oral surgery, orthodontic, periodontic, and multidisciplinary approach is required. So that allows the students to gain exposure to these different fields, fostering a comprehensive understanding of dentistry as a whole. So these elective courses allow the students to gain additional knowledge and skills in the specialized areas beyond the core curriculum. And the benefits of offering these elective courses is it helps the students to develop critical thinking, problem solving, decision making skills, personal growth or personality development, as well as professional networking with the industrial partners. So they encourage the students to explore the different perspectives and approaches and enhancing their ability to adapt to diverse patient needs and scenarios. Furthermore, these elective courses can be beneficial for career planning. Students can use these courses to explore potential areas of specialization or gain competitive edge in the job market by acquiring additional skills and knowledge. So overall, the elective courses in the BDS curriculum provide opportunities for the dental students to pursue their interest, broaden their knowledge, and prepare for their future careers in the dentistry. So these are the few examples of elective course topics which can be chosen for the BDS students. The digital dentistry, basics of implantology, sports dentistry, research methodology, herbal dentistry or Ayurveda in dentistry, basic life support, dental emergency management, smile design, which are not normally offered in the core curriculum. So what is the implementation strategy for these selective courses? So this strategy has many stakeholders. So the strategy involves collaboration with the industry experts, the curriculum integration or the experts, and student feedback is used for choosing the topics. So what is the mode of conducting these elective courses? So it can be done with the hybrid method involving both online and offline mode for skill development and for discussion. So the assessment methods we can use MCQs, short essays, case scenarios for discussion. We can ask the participant to demonstrate, and also the DOPS method can be used to assess the students for the selective courses. So before come to the conclusion, so the overall course outcome is we expect the students to learn a lot of clinical skills with the complicated, and they can the complicated situations, and they can overall there will be increase in their knowledge, and also it helps them to develop a communication with the industrial partners, networking. So all these things are benefits with this. So overall it can be recommended. So these elective postings or the elective in the BDS curriculum play a crucial role in providing students with a well-rounded education, enriching the learning experience, allowing them to explore their interest, develop specialized skills, and gain exposure to diverse dental cases. So this program will prepare the students to thrive in the dynamic landscape of the dentistry.
Stop sharing, please. Yeah. Dr. Arun, no, Dr.
Yes, ma'am.
Anand, my first question is, you have told us the importance of having electives in BDS curriculum,
Yes,
but what are you going to do as your project?
yes, ma'am. So first, I think we can initially take the need for the selective course. So we can conduct one survey of the students, whether means whatever the current curriculum is there, where it is lacking. So that feedback we can take it from the students. Then we can decide the areas of student interest which are lacking in the core curriculum, and those topics we can take it further with all the stakeholders, that is teaching faculty and all, and we can create a course content for the selective course, and then we can choose a small group of or batch of students for the selective course. We can train them, then we can compare this batch with the other batch which is not exposed to these elective courses, and we can draw some comparative studies between the two groups, and then we can recommend that these elective courses offers better clinical
Yeah.
skills and better knowledge without the
A good,
elective
a
course.
good, a good thought, but from your fellowship point of view, think from the feasibility point of view. So many things you won't be able to do for this particular project. You can always continue with your project later on. But for this particular fellowship, the requirement, think which part you can do it.
Okay.
My suggestion, probably you would be only able to do the first aspect, that is needs assessment.
Yes.
And there you not only involve your students, but you also have to involve your faculty. Okay. And then because you're trying to make some change in your curriculum.
Yes.
So then the stakeholders, two main stakeholders, your students and your faculty, their perception about incorporation of electives in BDS curriculum is important.
Okay.
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 So
And
I
later on,
believe,
we can take any particular course as elective,
and
and
later
then
on, then you can in the questionnaire also, one of the questions could be what kind of, or select or suggest the areas for the electives. Whatever you have shown us, the list is your
yes,
suggestion.
yes,
The
yes.
students and the faculty may have some other
Some other,
suggestion.
yes,
Okay.
correct. Correct.
Before that, you would also have to explain it to the faculty, may be aware of what is elective and what kind of, what happens and what goes within it. But your students may not be aware of ye elective kya hota hai.
Correct.
So maybe probably before you give questionnaire to the students, within the questionnaire, or you can verbally talk to them and update them about the term electives.
Okay.
Okay. That's from my side. Anybody else has any suggestion for Anand?
Just one suggestion
It's a
that
good
your
idea.
electives might definitely will be interdisciplinary as well.
Yes, sir.
So the question will arise कि ये modules तैयार कौन करेगा और ये सिखाएगा कौन पढ़ाएगा कौन. So you will have to think about when you talk to your faculty. These are the challenges which they will
Yes.
put front. So you'll have to think of strategies, discuss with them, so that people are actually proactive about this. Otherwise, the challenges will become so many that people will not agree or not be convinced about it. So good
Correct.
So
thought,
one
but
of
then you
yeah,
need
so
to
one of the
consider
questions actually, Gaurang, he can put as enabling factor and challenges, right?
Okay.
Yeah.
The questions could be enabling factor for the
Factors.
electives and the challenges which are likely to be faced.
Okay.
Yeah.
Thank you.
So if there are no other questions, can we move to the next project? 4. Who's roll
Thank you,
number
Arun, sir.
4?
Thank you, madam.
Dr. Jyoti.
Yes, Dr. Jyoti.
Yeah. Make it full screen and start presenting.
Yes, ma'am. Slideshow. It's a slideshow on, ma'am.
Slideshow, the symbol is down, hourglass symbol. Yeah.
No, it's
Go
not.
to the first slide.
Yeah, yes, ma'am. Actually, I prepared two topics, and research question is the first topic is evaluating students' progress using AI. So the main outcome or the aims and objectives of this is there will be less human errors in assessing the students and improved quality in assessing the students and the stakeholders. For I have not gone in depth regarding the literature as well as the research methodologies and study design. That I think I'll plan it later. But main idea behind this, as you know, the AI are in regarding to Chat GPT, whatever it is, like that we'll be making one model, so that when you are assessing the student theory wise or maybe practical also, I can involve later. So there will be some standard, and I'm planning to use this as a tool to assess the students. So the main stakeholders for this study will be teachers and the students, definitely, because the teachers are the persons who are going to correct, and the students. And the research questions for this topic is whether the AIs is really useful in evaluating the answer sheets during theory exams. And the second one, sorry, that is for the practicals. I just mentioned different. And is it more accurate for knowing the various grades of the students based on a particular standard? And is A more valid for assessing the normal standard requirement of a student? And is it supplementary for teachers who are assessing the students? And can this psychologically beneficial to students as well as teachers when you are evaluating? And does this improve the standards of evaluating the students in Indian examinations? And is it the environmental conditions also can be more accurately made using this thing during, especially during practical examination? And does this reduce the time required by the teachers to assess the students? And does this make both students and teacher relationship more compassionate or whatever it is? And I think I have to require to study more for this. So this is one topic I had. The other topic is the other topic is you can view, ma'am, full slide. So the other topic is adopting the clinical knowledge about dental materials for postgraduate students. Right now, when we go to the post-graduation, we don't have dental materials separate as a subject, ma'am. We have for the undergraduates, but not for the postgraduates. And so my thing is to adapt the clinical knowledge, like we study theory and all, some more regarding the dental materials in postgraduates. The aim and objectives of my study is it is more evidence based. More evidence based, you will be studying the dental materials as a postgraduate student, and this will improve the research intellectual ability of the postgraduate student with respect to dental materials they are using it. So the stakeholders for this study will be the postgraduate students who have joined and the teachers, and definitely some dental material manufacturers who are the stakeholders. And the research question of this topic is, does the high level knowledge about dental materials, is it required for the postgraduate students? And
Jyoti, I suggest don't read out all the research questions. These
okay,
are not, first of all, they are not called as research questions. They would be a part of questionnaire which you're going to probably give it to the stakeholders.
okay.
So I think what we have is there something else other than research questions in
No,
your
ma'am.
on your slide?
That is the that's it, ma'am.
Yeah.
I
So can you
had
stop
selected
sharing,
top.
please?
Yeah, yeah.
Yeah. So Jyoti, there are two ideas.
Yeah.
what I understand. Both ideas are good. It is up to you to go ahead and select one of them, depending upon the feasibility from your aspect. That only you can judge which one of the two is feasible within the given time frame of your fellowship. So if you're uh, going towards use of AI in evaluation of or assessment of students, then you have to understand what assessment are you going to evaluate and what type of AI are you using to evaluate. These are the two things you will have to first think, and whether your faculty is well versed with the AI technique which you're planning to do. And then how are you going to, because from your slides, we don't get any idea as to how exactly are you going to go about using that AI.
Yeah.
So
Study
then,
design, that's what, ma'am, I have planned
yes, correct.
separately.
So then you will have to decide which assessment method are you trying to use for the effectiveness,
Yeah.
and which is the AI system best suited for that, and whether it's available in your scenario, and whether your staff faculty is well versed with that AI,
Yes, ma'am.
right?
That's
Regarding,
I
go
just
ahead.
wanted to ask Suhasini Nagda ma'am regarding
Yeah.
these two, which one will be the better in this part of time? Because both I can do it, but it again, ma'am is the right person to take a decision and guide me, I feel. So whatever ma'am
Dr. Jyoti,
suggests, I'll.
can I comment? Come in and
Yes.
see before from your presentation, it is not clear that what exactly you will do, how you will do it, and which kind of tool you will use. So expecting that AI should do assessment, how that will happen is not clear. So unless we have a more concrete plan of what actually is intended to be done,
Yes.
give us work on this.
Yes.
So have
Hello.
you thought of any
Hello.
which you are regularly using? Can you just share what exactly you're planning when it comes to the AI topic?
Sir, actually, I couldn't hear what. Hello.
Yes,
Hello.
ma'am.
Sir. Sir, AI is basically I have discussed with the software people. They're ready to develop one similar to ChatGPT and provide for the evaluation.
No, but ma'am, when
No, it is similar
ChatGPT
to
is
that.
already
It's
available.
similar to that. We have to involve further dental education or dental examinations, theory
Ma'am, so
examinations.
that's the point, that expecting the IT folks to create a software for you and that one AI based
Yeah.
might be a little too much to expect in the given time frame of our project.
So it's like just maybe the second topic will be better, I think, no, sir.
Jyoti, you also need to develop that second topic.
Yeah.
It's just the two ideas you presented today,
Yes, ma'am.
correct? So then we would not be in a position to comment unless we know what exactly are you planning to do in both these ideas.
That's what, ma'am. One, I have to
I
give
got it,
the.
but then the details are not available. It's only the title which we know. And
So,
probably you prepared the slides also very in haste. A lot of spelling mistakes.
Okay.
Yeah.
Madam,
Should
can I
not
give
do
a
that.
small input?
Yeah, sure. Go ahead.
Regarding AI, what I got to infer from what she wants to do is that, for example, ChatGPT, if you type in a question and it will give a standard answer, and based on that standard answer, all that particular answer of a student will be automatically assessed by the software, whether it's ChatGPT or a new one. Similarly, for a question paper, standard answer has to be generated by the software for the whole question paper, and then automatically she has to scan the answer papers with the optical recognition software, and that will be the basis on which the standard answer will assess the answer of the student. That is what I Thought maybe
It's
Yeah,
just a
I
qualitative.
understand, but see, you have to understand that it takes away the whole idea about the long answer and short answer question. It's like you are trying to convert short and long answer questions into kind of objective questions, wherein MCQ can be assessed using
Yes.
optical, all those things. I- in short answer and long answer question, the subjectivity part of it does creep in.
yes.
Yes.
So if you're giving everything to AI, and then that aspect you're just taking it away, because it's a machine at the end of the day. So before, Jyoti, you go ahead with the technique, think of the not only from the easy part of it for the teachers, that it becomes easy for the teachers to assess, but there are other aspects to assessment as well. Okay, so how useful it's going to be to the students and the teachers, you have to think. So before actually putting in efforts in developing a tool in AI, think how useful it's really going to be to the teachers and the students. Is it going to only save time and not give any value addition to the assessment? Then it's not going to be accepted by either of them.
Hmm.
So think before you go ahead with the topic and put in so much efforts.
Yes.
You have to be clear yourself before you actually, go ahead.
Hmm.
Yeah. Am I
Yes,
making
yes.
sense?
Yes, yes, ma'am.
So can we move ahead? Yeah, good.
Uh, Madam, before going into my topic, I would like to say that when I chose this topic, when Madam said that like we have to select a topic, I went directly to the head of the institution, like, sir, I want to do a project under the institution. So I want to do the project on this particular topic. So he asked me to make a presentation because this topic is related to different departments. It was like an interdisciplinary topic. So at institutional level, madam, we structured it in a proper way. Like we divided into 4 different years. That is the part of the BDS curriculum. But for this certificate course, how to narrow it down, I'm lacking a bit clarity in that, madam. So I hope once I present it, madam, you can guide me regarding that, how to narrow it down. Now, my topic is, madam, implementation of an preclinical module of oral implantology for BDS students. If you go to the background, madam, we have come to know that dental implants have actually revolutionized the concept of tooth replacement. But simultaneously, it is the moral obligation of, as a healthcare provider, to educate and motivate the general population about the superior modes of treatment in the field of medicine or dentistry. Madam, I want to highlight on this particular point. Why I'm saying it is about general population is because we saw that lot many health schemes, when it was implemented, oral implantology was there in it. Like it was done free for the patients. Down the line, the government is withdrawing those schemes. So we thought that somewhere down the line, whether the students are not well trained enough or the population is not being well educated. So we thought that implementation among the undergraduate medical or dental students concerning any updates in this specialty will be beneficial in educating the general population, keeping in mind that undergraduate students are considered the best ambassadors of this specialty. I went to different literature as well, madam. Everywhere it is spoken about what is the importance of oral implantology, be it as a general practitioner, or be it at undergraduate curriculum, be it at postgraduate curriculum. But a structured methodology also is not been given how to go ahead with the teaching aspect. Even I went into the uh, Dental Council of India gadget, madam. Therein I found that this topic is being covered by oral surgery department, prostho department, and perio department in dentistry. Uh, they're giving a structured number of hours for the theory part, but there is no structured outline for the preclinical part or the clinical part. Then the student awareness regarding dental implants. One second, madam. Something happened to my screen. Student awareness regarding the implant can help in eradicating these all are like the student is not aware about this particular thing. When we spoke to when we speak to undergraduate students, they are little bit theoretically also less exposed to this particular treatment protocol. Second thing, what we saw is every BDS student, once they passes on, it has become a fashion or it has become a trend that they have to spend some extra amount for any other courses. And simultaneously, Dental Council of India has taken subsequent steps that indicating that these courses are not any kind of certified degrees, not even fellowships. In a broader spectrum, it has been said that these such kind of things are not to be encouraged. So we thought that if at undergraduate level we give them the basics of oral implantology, so that tomorrow when they pass out, they can understand what are the advancements in oral implantology. Based on that, they can spend on their learning. One second. Then the idea of the study was, madam, we divided, keeping in the BDS curriculum that has been given by the Dental Council of India, like what are the aspects of oral implantology theoretically, as well as the preclinical part, we divided into the all 4 years, keeping in their regular syllabus. We didn't add anything in the syllabus. We just specified that if it oral implantology is considered for an undergraduate, suppose a first year student, which part of the syllabus is essential for oral implantology. So we have structured down that. We had a discussion with the head of the departments, like how can we enhance on that, whether we have to take separate lectures or in the routine lectures it can be done. Second thing, madam, is coming down to narrow down these all things into the study, madam, like whether we have to conduct a examination at the end of final year or a questionnaire for a student who has already passed first year BDS and is right now into final BDS. That thing was there in my mind, madam. That thing I didn't get a clarity, so I didn't go ahead into that part of the study more, madam. Now, when madam was speaking, like what was your outcomes or what are the desires, what were the limitations of oral implantology in undergraduate curriculum was like we do not have inadequate lectures on implants, insufficient time in already crowded college wherein we focus more on postgraduates, very poor training or limited number of patients. The outcomes, what I look, if this particular structured module is integrated into undergraduate curriculum, is like more number of lectures will be there, constant preservations to improvise will be there, madam. Then proper preclinical and clinical training will be there, well-structured course for oral implantology, and it should bring more awareness among the patients as well. As well, if the undergraduate is well educated, definitely is going to educate the general population. Ultimately, it is like minimal training required after undergraduate curriculum for oral implantology, madam. So these are my references, madam.
So, Siddharth, what I understand is you are trying to have a new module in the BDS curriculum which involves oral implants,
Yeah,
right?
madam. It is already there, madam. The theoretical part, they're just giving the syllabus. The council is giving the syllabus, but that the
Okay.
teaching part is not being implemented.
So theory
Along,
part is already there, and now
yeah,
what you want to achieve by this project, you want to incorporate the practical aspect of it.
yeah, exactly, madam. The preclinical part I want to involve so that once they
Why
pass
are you
out,
saying preclinical when it is practical, when they're going to do it on patients? How can you call it preclinical?
Anywhere in the guideline, madam, what I found in the syllabus and all, it was not spoken about the patients. When it becomes to patients, it becomes like the evaluating the skill becomes very difficult for us. But when
Okay,
it
so
becomes
then
preclinical,
preclinical means the students would work on some model,
yeah, madam, that's in the
and
end of
those
final year.
models are already developed, or you're going to try and develop them.
Uh, the models are like, madam, normal. Suppose it's a
Normal.
mandible.
Okay.
It's
Okay. Got it.
it's
Got it.
yeah, madam.
So just keep it. You decide which year it is appropriate. I feel it would be appropriate for the fourth BDS because they have
Yeah,
learned theory of oral implantology all throughout, first, second, third, and fourth year.
yeah,
So
madam.
what you can do is you can this for this project you can have a structured module
Okay,
to
madam.
sensitize the students for
Okay, madam.
in the skill of oral implant, whatever, oral
Okay.
implants.
Okay,
And
okay,
then
madam.
that module would have a few of time spent on theory classes where all the 4 years ka whichever faculty is involved in oral implant
Yeah,
can
madam.
come and just give refreshing talks, quick talks for 10 minutes. And
Okay.
then maybe you don't target the whole batch for your project because it becomes difficult.
Okay.
Maybe you can call it as a pilot and do it in a restricted number of 4th year BDS, and then you can continue it later after you finish your project. So
Okay,
take
madam.
those limited number of students and have that module developed, the skill module.
Okay, madam. Okay, madam.
So then
Okay,
you
madam.
you can assess it using OSPI.
Okay, madam. Assessment
Yeah.
using OSCE.
So,
Okay.
so
Okay.
that's what comes to my mind when you shared the idea. Of course, you are
Exactly,
free
madam.
to change.
No, no, madam. That's what I was thinking. It's very vast. How to narrow it down for the certificate course, I was
No, they
thinking, madam.
already have the theoretical knowledge. You want to give them the practical aspect in the
Yeah, madam.
models
Yeah,
before they
madam.
actually are exposed to the clinical side of it. So
Exactly.
then you
Exactly.
restrict to that. Have
Okay.
introductory theory topics, and straight
Okay.
away then expose them to the models. Take a
Okay.
small batch so that the implementation of model becomes easy, and
Okay.
assess them using OSCE.
Okay,
And
madam.
then
Okay.
you expand your project by involving the rest of the students, because then ethically you cannot do that because you are not exposing the other batch. They are being left out. So once you
Okay.
finish your project, you can take it ahead and involve the other students as well of the batch.
Okay. Okay.
I just want to add to Dr.
Yeah.
Siddharth, madam.
Yes, sir.
Actually, in our college, this implant course we teach it in a integrated teach ITL we take, madam. That is integrated
Okay.
teaching and learning method. So where all the concerned specialties will be involved in the same platform, and all the topics from the diagnostic till the treatment plan or the processes, everything will be covered in
Yes.
a proper module way. So I think
Yes.
he can also develop something like that.
Sir, my question is, sir, when you're teaching it only to final years?
Yes, we are teaching it to final years
Okay. Okay.
because
Okay.
by that
Is
time
the
their
skill part
fields
of
will
it
be different.
involved in that integration, or it's only the theory part of it?
In the ITL, the mainly theoretically, all the specialists will be covering the theoretical this thing, madam. So after that, suppose if the students are interested, they'll be enrolling for that basic implantology course, where the same faculty who have conducted this ITL, they'll be training the students
Okay. So
on the
that's a
models.
different way of doing it.
Yes,
But
then they'll
you are,
be allowed to do the
yeah,
patients.
yeah.
What difficulty I found is like what sir is saying is right, madam. But like with one batch we saw, like when we introduced this thing, like those who are interested, they were like, sir, we have already paid this fees. This is there in the curriculum. Why are you asking us to pay the extra amount for learning this? Then I thought, okay, they have a point. It's our duty is not just to give them the theoretical part. We give
Okay.
them a
Yeah,
preclinical hands.
yeah,
That is what I was thinking to
yeah.
implement, man.
So now that's what you are trying to do it with your
Yeah,
project,
man.
right?
Yeah, man.
Okay,
Yeah, man.
fine. Fine. So if there are no questions, can we move to the next project?
Yes, ma'am. Yes,
Can you
ma'am.
stop
Sure.
sharing, please,
Yeah, madam.
Dr.
I am just
Siddharth?
looking.
Yeah.
Yeah, madam. I am just looking how to cancel it. It has minimized. I'll just close it down. I guess it has
Yeah.
stopped doing.
Yes.
Thank you, madam.
Ma'am, is the slides visible, ma'am? Is the slide visible, ma'am?
Yes, madam. Yes, madam.
Okay, okay. Good evening, everybody. Warm greetings from Mysore to you guys. So, just a second, ma'am. So, the topic for today's presentation or my project presentation is knowledge to know the knowledge, attitude, and practices of undergraduate dental students on for geriatric denture wearers, the need for interprofessional approach. Projections for India and states 2011 to 2036, there are 13.8 crores of elderly people in India, comprising 67 million males and 71 million females. With the increase, just a second, ma'am. So with the increase in the number of edentulous patients, there is actually a need for complete or partial dentures. That is rehabilitation of such patients with either complete or removal partial dentures. Hence, there is a synergistic relationship between nutrition and the integrity of the oral cavity in health and disease. So with this, the identifying need, there is always direct, indirect effects of aging on either the oral microflora or the person himself or herself. So the direct effects would be the waning of cell-mediated immunity, changes in salivary antibodies, hormonal changes, and altered physiology of oral mucosa with aging. The indirect effect would be the denture wearing per se, which is the kind of treatment that we prosthodontists actually deliver to the patients. Together with this, there is dietary changes. There is a medication antibiotic therapy which the patients will be exposed because of systemic conditions, which mainly results in change in the oral microflora per se. So with age, changes are also observed in the oral mucosa, which becomes increasingly fragile and stippling, resulting in increased susceptibility to various pathological conditions such as Candida infections. This is compounded further with a decreased rate of wound healing. These signs are often accelerated in edentulous individuals seeking prosthetic treatment and with multifactorial etiology, increasing the risk for further infections. Nutrition is the modus operandi for providing adequate food components for health and growth sustenance, and especially in old individuals, giving their impediments and requirements. Poor oral health and decreased ability to chew influence the food selection, especially in our geriatric denture wearers, and the nutrition status of the individual, and hence the nutrition status assessment becomes an imperative so as to offer timely dietary advice to this expanding population. So, as said by Willett, tell me what you eat and I will tell you what you are. So, the objectives of any kind of dental treatment are two important ones: to bring about and maintain a healthy functional environment, which all of us know that we must assess the nutrition status of the individual, and to construct as anatomically and as physiologically perfect restorations as possible. That is mainly to understand and master the biomechanical principles of restorative dentistry. So this culminates in the realization of these factors forms the entire basis for the essential role of nutrition in prosthetic dentistry. Dentists and dietitians are actually, we have actually seen that they do not collaborate each other in order to enhance the health in the community dwelling older people. So to establish the interprofessional collaboration, they need to gain knowledge and skills about nutrition and oral health to effectively recognize the problems in this nutrition aspect. So interprofessional education for healthcare professions is needed to stimulate interprofessional collaboration to improve the care for older people. Effective dietary counseling in the dental setting can significantly reduce the risk of oral disease. However, studies suggesting that dental professionals are not instigating dietary advice on a regular basis is seen in most of the studies done so far. So the question arises is, whose role is it to give the dietary advice to our prosthodontic or geriatric denture wearers? Hence, there is uncertainty about the roles and responsibilities when providing dietary advice. Hence, the aim of the present study will be to assess the knowledge, attitude, and practice of the undergraduate dental students regarding diet and nutrition counseling for geriatric denture wearers, and to assess the need for this interprofessional approach. So the method would be a cross-sectional questionnaire-based study, which will be carried out around 1 or 2 the undergraduate students, which includes the final year BDS and the interns. Right now, the final year BDS is 46 and 95 interns in our current year. So the responses will be subjected to statistical analysis using SPSS software version 22, and the tests will be used to be frequency distribution and Pearson chi-square test. So the procedure will be a questionnaire containing 15 closed-ended questions regarding diet and nutrition and its effect on nutrition for geriatric denture wearers, which will be prepared with the consent of the IPE team, which includes a dentist and a nutritionist together. A pilot test will be conducted among 15 students among final year and interns or the residents before the administration of the questionnaire for checking the reliability and the validity. The students will be informed about the importance of the study and will be included on a voluntary basis. The questionnaire will be converted into an online survey using Google Forms, and the links will be forwarded to the participants. So here we aim to assess the knowledge, attitude, and practices. So this would be my outcome of my study, where the ultimate long-term outcome is to improve the patient's care given by the undergraduates. If I have to sum up via table, so this would be my short-term outcomes, my intermediate and long-term outcomes. So my short-term outcomes is the increased in the knowledge on the dietary counseling for among undergraduate and the interns. And the students will be more confident when listening to their patients to cater to their needs. Students are more confident in interpretation of clinical situations and giving the right kind of treatment together with nutrition supplements. And students will be satisfied with this kind of program where the interprofessional team approach will be involved. The intermediate outcomes will be a development of a satisfactory dental-patient relationship, and students perform better in all the clinical postings because the interprofessional touch will be included. Better acceptance of roles and responsibilities of the interprofessional team. They'll get to know the awareness of another specialty being included. The long-term outcomes will be an integration of interprofessional nutrition curriculum, which leads to increased pass percentage of students with better results, improved patient care by trained graduates, and enhancement in their professional life. So these are my references. Actually, one study which has been done in 2021 where the nutritional counseling was actually done among dental practitioners. But as such, I felt that the nutritional counseling or interprofessional touch has to be included from the undergraduate curriculum itself, where they get to know that the team approach is very important. And until unless there is a team approach, it's very difficult to come into a clinical consensus. So hence, I would like to target the undergraduate students, especially the final year students and the interns, where they're actually in direct relation with the patients. They are actually involved in the delivery of the complete dentures to patients. So I thought I will be assessing the need assessment initially to know their knowledge. And maybe if time permits, maybe a small workshop can be organized where a nutritionist and a dentist can present case-based scenarios to them, and we could get suggestions from them and try to give that kind of knowledge to our students.
Yeah.
So,
Meenakshi, if you can stop sharing.
yes, ma'am. Yes, ma'am. I'll do that. Yes.
So, Meenakshi, my basic question to you is, by answering the questionnaire which is prepared by you,
Yes, ma'am.
how it would lead to your outcomes? Your outcomes are increase in the confidence. Students are more aware of the interprofessional importance of interprofessional collaboration.
Yes.
How are they going to achieve by just answering the questionnaire about the denture and diet?
Ma'am, initially maybe I thought a needs assessment would be better so that I'll get some awareness whether they are aware of that such kind of things also needs to be educated to patients. Maybe a small workshop or where a interprofessional, a nutritionist and a dentist can collaborate together to deliver why a nutrition supplement is a modus operandi before they could send the patient, or maybe post operative care. A nutrition supplement also has to be delivered from the operator.
So then you will have to think what your objective is.
Yes, ma'am.
When it comes to this particular project. You just want to find out the perceptions of the students about the diet and the denture, or you want to impart, or you want to give them more knowledge and impart skills or attitudes when it comes to denture and diet with regards to interprofessional, that it requires interprofessional collaboration. So these are two different things. So then you'll have to think exactly what do you want to achieve by this project. So depending upon that, your methodology and the way you approach would be different.
Okay.
What do others feel? Because you are all subject experts.
Yeah, it's good.
Yes, madam.
Would be of help to me also. Our seniors are also there because.
So
Madam,
what Meenakshi madam can do is, madam.
Yes, sir.
So with lack of knowledge at the undergraduate level about
Yes,
the
sir.
nutrition, then she can recommend that since the students are lacking the knowledge of the basic nutrition instruction to the geriatric patients, so it is required to have a multidisciplinary collaboration to educate the undergraduate students, and then later on the nutrition chapter something can be added to taught to the students.
So
I
then
think,
first,
yeah, I think she wants to do on interprofessional education with a topic commonly taught is diet. That is what I felt from her presentation.
Yeah, madam, but
Ma'am?
what she is going to do is she is going to give the questionnaire to the students. Just by giving the questionnaire, how is she going to make them aware of the interprofessional education is something I don't understand.
Yeah, that's
So
true.
that's my question was.
Ma'am, can I, ma'am, just a second if I could interrupt. Can I also include the interprofessional readiness scale also so that they will get to know about the need for an interprofessional approach?
But is the
Would that be
scale
a better idea?
very fitted to the diet and denture?
No, ma'am, that may probably I'll have to validate again and
Then it's a big thing. Preparing a validated as a part of your project would be a big thing. So then probably you start by having or taking or gathering the evidence that students are basically not aware of this topic of nutrition and when it comes to denture. And they are also
okay.
probably not aware that it needs interprofessional collaboration, not only by the dentist, but the other experts are also involved. So you gather that evidence that the students are not aware, and therefore something needs to be done to make them aware of and such an important topic.
Yeah,
And then you
can I
can,
do a
once you get the evidence, and then you can start developing a module which involves different experts, which talk to the students with regards to denture and nutrition. But that would be a separate project altogether. Are you getting what I'm trying to say? It's ultimately it's up to you what you want to do, but these are my suggestions or ideas.
Ma'am, I couldn't hear
Meenakshi?
you, ma'am. Yes, ma'am, I
No,
couldn't hear you, ma'am.
no. I said ultimately it's up to you what you want to do. These are only my suggestions.
Yes, yes.
Yeah, so
Yes,
think
ma'am.
what you want to do. You want to only gather the evidence because, and if you already have evidence from the literature, then go ahead and prepare a module. But then that would not end at only giving them the questionnaire. It's not the method by which you impart. Only knowledge can be done, but not the other things. Attitudes and all, and importance of interprofessional education can't be given by using only questionnaire one time, that too to the students.
Okay,
Yeah.
okay.
Okay.
Ma'am, how otherwise can I enrich
That's
their
what I'm
attitude, ma'am?
saying. So,
If it is
so
possible.
other is you will have to develop a module, which is a teaching module for the students, involving all the other experts in the interprofessional, in that denture and nutrition.
And not just the faculty, interprofessional faculty, it's also interprofessional students of other things like nursing, MBBS, and especially the nutrition faculty and the students. So you are taking a very big bite which will not be able to be realized in this 1 year. So what you need to do, you divide it, you want to do interprofessional, then you readiness scale and other things and all. So small topics are taken in that diet can be taken, but that's a module that you prepare. And I think you need to rethink a lot in this. Idea has not gelled, but idea is good.
Okay.
Okay. Fine. So can we move to the next presenter?
Yes, ma'am.
Yeah, go ahead. Make it full screen and start presenting.
Good evening, everyone. Hello.
Yes, you're audible.
Yes. So, ma'am, I have the title, two titles for the same topic. One is the implementation of self-directed learning for undergraduate rental students. The other title is assessment of the students' perception and their abilities on implementation of a self-directed learning for undergraduate dental students. So I'll be covering under the following headings. So the basically the education system, the objectives of the education system was given by the Benjamin Bloom, which in 1956, which was again revised in 2001, where the actions of the words describes the cognitive process. He emphasized on basically on the actions of the words in the teaching methodology. So there are a number of methods in teachings with basically for two types. One is the teacher-centered, the other one is the student-centered. The teacher-centered teaching methodology involves whether it is a direct instructions or flip classrooms or kinesthetic learning, or it can be a student-centered where differentiated instructions, inquiry-based learning, expeditionary learning, personalized learning, and game-based learning. There are other methods also in teaching methodology where like high-tech and low-tech based on the technology involved, and the newer learning strategies involves the direct self learning, problem based learning, collaborative learning, and self directed learning. The self directed learning is an essential component basically on the student centered learning. Now coming to what exactly is our self directed learning. So Novel has given the definition of self directed learning as a process in which the individual take the initiative with or without the help of others in diagnosing their learning needs, formulating learning goals, identifying a human and material resource for learning, choosing and implementing the appropriate learning strategies, and evaluating the learning outcomes. In other words, it can also be called as an autodictatism, which is a form of an education where the students or the learner play an active role in the knowledge, skill, and attitude acquisitions. The students are the primarily going to take a initiative with the self-learning, which involves the planning, selection of the topic, planning, then and be self-motivated enough to complete the entire learning process. The main four keys involved in the self-directed learning, which involves being ready to learn, the setting learning goals, engaging in the learning process, and evaluating the learning. There are other subdivisions of self-learning, which is basically facilitated learning and the self-placed learning. In facilitated learning, which involves major role by the facilitators or the teachers. In self-placed, it is purely based on the students. So the facilitated learning can be done through audio lectures, small groups, donut rounds. Whereas self-placed, the learning can be done by online courses and digital courses. Now coming to the theory of change. The dentistry is an ever-evolving science which needs the learner to be flexible and be able to plan its learning according to the present requirements. The self-directed learning should carve the naive students to clinician capable of making participants the clinical judgments through his continued experience while undergoing the undergraduate or the postgraduate trainings. The basic ultimate goal of this self-learning is to make to excel in their performance as a doctor and to become a lifelong learner, which may not be achieved by just bypassing validation of the information. The rationale involved is that there is a decline in the dentist's knowledge with the time, which may result in lower quality of the patient's care, which is suggested that the dental professionals continue to learn through their professional career. It also requires the learner to plan their learning and set a task-specific goals, and thus is one of the many methods that helps in developing the metacognitive skills, which also helps in a good learner translate into a good clinician. The objective of the study is to measure or assess the readiness of the self-directed learning in a second year undergraduate dental students and for its possible impact on their learning. How this is different, it is going to cover all the domains of the learning, which is cognitive, psychomotor, and affective. However, it can also work effectively only if the learner possesses certain characteristics such as self-confidence, curiosity, thinking, critical thinking, and decision-making abilities. Moving on to the literature reviews, Hill M. Et al. Done the study on self-directed activities, resulting in a more gain in knowledge in contrast to the traditional teaching methods, as assessed by a greater variation in the response to this of the students regarding two types of teaching strategies as a conventional technique and self-directed learning. The next literature.
Shilpa, can you skip the literature part of it? That's okay.
Yes.
You've done. Yeah. So go ahead.
Now moving on to the outcomes. So the short-term outcome would be there will be an increase in the interest in this subject in the patient, in the students. The students will be motivated, will motivates to learn the selected topics, increasing the self-monitoring and evaluation, and it will also increase in the self-confidence. The intermediate outcome would be increase in student-teacher relationship, increase in the interaction among the peer groups, increase in the communication, and also improvement in the problem-solving skills. The long-term outcome would be improvement in the professional skills and the self-efficacy and high level of cognitive skills, and to become a lifelong learner. This is the broad concept mapping which I have completed now, based on the self-directed learning, which so increasing the interest in subject.
Shilpa, you've already said that. Go ahead. Go ahead. Go ahead.
Yes. Yes. The indicator matrix, the study will be assessed on the instrument which is used is the Fisher's readiness scale, where the 40 questions will be given in the questionnaire form, Google form, with a score of 200 scores. This will have three domains. One, the first segment will cover the self-management, comprising of the 13 questions. The second on a desire to learning and self-control. And those questions will be, this is an example of how those questions will be set on the Google format. So how often do they browse the books? Or,
skip, Shilpa,
yes.
skip.
Yes. Response to, and those response will be assessed on the Likert scale on 1 to 5. And methodology which involves the topics and the schedule for the self-directed learning will be finalized with the input from the head of the department and other faculties. The topics will be selected from the BDS curriculum itself. After the completion of the self-directed learning, students will be asked to provide a feedback that is through the Google form. And throughout the following step, throughout the procedures, the following steps will be followed, like establishing learning objectives or assessing the resource, adopting and executing learning activities, or monitoring and evaluating, and refining and reassessing the process. And these are the references. Thank you.
Can you stop sharing?
Yes, ma'am.
So Shilpa, I can see that you've done a lot of work and it's a good topic. My
Yes,
question to you is, how exactly are you going to do self-directed learning session with the students?
Ma'am, first we will be conducting a theory classes which involves audio visual like regular conventional teaching methodology, and after that we will give us a topic on a digital material or a preclinical process. So those topics the students will be able should present a seminar on those topics. So after the completion of those seminars, so how much they were able to understand the given topic, and as compared to what other conventional teaching methodology.
So
How
you're
much they
going to
understood.
use student seminar as the way of
Yes,
introducing SDL to your students.
yes, ma'am.
Okay, I hope you have thought about the facilitators for the students when they're doing it or when they are preparing it,
Yes,
because without that, and the facilitators should also give feedback to the students when they're doing it, when the process is on and when they actually present
yes,
the students' seminar. Okay,
yes, ma'am.
fine. I don't have anything else to add. If anybody else wants to ask any clarifying questions to Shilpa, otherwise we'll move ahead. Gaurang, we are really, really late. How are we going to proceed? Because there are 3 more projects to be discussed. Gaurang, are you there? Hello? Gaurang?
Ashwini, I am here.
Yeah, so madam, there are 3 more
I was
projects to
talking,
discuss.
I was talking and it was muted. Sorry. Even
Yeah,
Shilpa,
okay.
I had some questions. But
Yes, ma'am.
Okay.
I think we can have the three of it. One more session we can take maybe, so that other also people are ready with that. Because today, if we take the three, it will become 9 o'clock.
Correct. Correct. Exactly.
So when can we do that next?
When should we have it? Any preferred day?
Next week.
Next week Tuesday.
I'm directly free on 8th
Tuesday.
of December.
Tuesday?
No, Tuesday not possible for me.
Oh, madam, we have a conference.
A conference, ma'am,
Yeah,
from 7 to 10.
So after that only, otherwise
8th
we can
December is the
No.
Friday.
What I will do is, if you all are okay, in a day or two, let us know whether we can have the 3 sessions. Me and Gaurang will be.
Yeah.
That, ma'am, tomorrow or day after tomorrow also no problem, ma'am.
Yeah, okay. Yeah,
If
that is one
sir,
thing.
if Naren sir
Yes,
is
yes.
free,
madam, I have kept patient
I'm okay
appointment.
with this.
Yeah.
Anything is fine with me.
So tomorrow itself, Gaurang is possible?
Yes, ma'am, possible. Tomorrow, 6 o'clock, same time?
Yes, 7:30, 1
yes,
6 o'clock. Yeah.
done.
Okay.
So
Done.
in the self-directed learning part, I wanted to tell, first of all, what is self-directed learning? Are the students ready for readiness scale? Whether they're ready for the self-directed learning? What about other faculty member? See, the umbrella of competency-based education says that you use all multiple methods and multiple assessment methods also, so that the students are prepared for various things. One, for example, you are saying self-directed learning. It's not only seminar. It is working in a group so that they can all prepare together. And what topic you are going to give? Are you going to help them with the references?
Yes,
Are you
ma'am.
going to, all those things you have to prepare. And when you say seminar, you will not be able to get all the students covered up. So it can be maybe a small presentation because all the groups need to be covered. You have 100 students or 40 students?
Ma'am, 80.
80.
80, ma'am.
Even if you make a group of, Ashwini, can we make a group of 8?
Depending upon how many faculties you have and time frame for you, then that you will have to decide.
Yeah,
The
there are a lot of
feasibility part
things you
of
need
it.
to think. And the second I wanted to tell about the AI is there is no tool ready available for assessing, evaluating in AI. If you go to make a assessment tool, it will take you whole 1 or 2 years. So you need to say how AI can be leveraged for, see, incrementally, the longitudinally, the students can be shown whether they are improved or not. So that can be kept, or you need to think about it. Otherwise, the AI seems very lucrative topic, but it's very difficult to complete it.
One option for the AI is to consider using AI as an adjunct to your teaching. So rather than focusing on AI for assessment, you can consider developing a project you are using AI as a part of your teaching.
Right. That can be done. Because the AI can be used for teaching in multiple ways. Yeah. Next week, what we are going to do is preparation of the questionnaire. Gaurang, questionnaire preparation. How to
planned a session on feedback and reflections next week.
Yeah. Okay.
We can change that if required. We can reschedule.
I feel preparing a questionnaire will be important for all of them. Most of them will end up doing a need assessment. And also, if 1 hour questionnaire and 1 hour feedback can be done. No, 1 hour, tomorrow we are meeting for the 3 presentations, right? Or you want to meet on Tuesday only?
Tuesday is
Ma'am,
better.
I think
Huh?
Tuesday, every Tuesday is already fixed, no, madam. So accordingly, patient scheduling will be easy for me.
Acha. So Tuesday 6 to 7 we can have a presentation, and 7 to 8 questionnaire. Gaurang and Chinmay will do it.
Yes.
Is that okay or with all of you?
Yes. Yes, ma'am.
Yeah. Okay. All right. Good night. Thank you, Ashwini.
Madam, can I
Thank you.
just one reminder? Last time I had